Hello, this is Aaron Shoemaker, and I'm here with Steve Swinney today, and we're going to talk about the CHF STARP goal for this year. And Steve is the Chief Quality Officer for St. Vincent Health. Steve, what is our STARP goal this year for CHF?
Well, Ascension and St. Vincent Health has asked us to reduce our heart failure readmission rate by 4% for patients 18 years and over. And that's different than what we've had before. In the past, we've just focused on patients over 65, but this year it's everybody over 18.
So every patient over 18 at this
Yes,
point.
with
Okay.
heart failure.
Well, and what are some of the general strategies we want to use to achieve that goal?
Well, we navigate all patients pretty aggressively. So patients that are in the hospital with heart failure, we make sure that somebody on the outpatient side, oftentimes within an AMG practice, a nurse comes over and sees the patient and then takes care of the patient for the first month afterwards. We engage the primary care physicians very actively as much as possible. They know about the patients being in the hospital. We look at ways of making sure that they're engaged. Cardiology is pretty heavily engaged. And then the biggest and the one I think most important for today is influenza vaccines.
Yeah, I know you wanted to talk to us about what we can do for CHF through the flu vaccine. So what are your thoughts on that?
Well, we know that influenza vaccines are effective. Varies year to year. We're hoping this year is going to be a good year. All patients over 6 months of age should have an influenza vaccine. But particularly patients that are high risk, because we know outcomes are better. We know mortality is better. We know admission rates are better. We know readmission rates then are also better. So we need to be immunizing all of our patients over 6 months that don't have contraindications, but definitely those high risk patients like heart failure.
Great, thanks, Steve. So today we want you to take away that CHF is a STARP target in trying to reduce readmissions by 4%. And the big goal that we want you to remember from today is that we can influence that by having flu vaccinations for our CHF patients. We'd love for you to take every opportunity in your daily clinical practice, and we'll also be helping by running reports on patients with diagnoses of CHF and finding those who have gaps and reporting them to your practice and to your front office to help us work through those patients and achieve a high influenza vaccination rate for them. Thank you.